suicide, generally incurable and ongoing chronic disease, affects approximately 133 million Americans, representing 45% of the total population of this country. There are many people around us with incurable diseases that desire their time to end. Physician-assisted suicide, or euthanasia, has been considered by many. And although bills have been reviewed by the court, all of them have been turned down. I have done extensive research on this topic, making me credible to speak about it. Assisted suicide should be considered legal in all states here in America. First, I will define physician-assisted suicide and euthanasia. Then I will discuss the patient's need for physician-assisted suicide. And finally, I will discuss the financial state of a person with a critical disease. So first, let's define physician-assisted suicide and euthanasia. According to the sanjuan.edu website, retrieved on May 16, 2014, a post by Dr. Macy M. states that euthanasia, also known as mercy killing, is a way of painlessly terminating one's life with the humane motive of ending his suffering. Physician-assisted suicide and euthanasia are a bit different, although they are used for the same purpose. According to the northwestern.edu website, retrieved on May 20, 2014, physician-assisted suicide is when the physician provides the necessary means of information and the person performs the act. And euthanasia is when the physician performs the intervention. Now that I've talked a little bit about what physician-assisted suicide is and euthanasia, I will go on to describe the patient's need for such a procedure. Ending a life this way has shown to be very controversial, but patients have taken it into consideration to make an end to their suffering. According to an article posted on the Los Angeles Times in 2013, Bill Benting, now 88, who was arrested in July of 2012 on suspicion of homicide in the death of his terminally ill wife, said it had become unbearable for her. The morning of her death, she asked me to fix her a drink. They said their goodbyes, and she disconnected the oxygen supply. Soon after, she passed away. So why shouldn't a person with a deadly disease without a found cure have the right to die? According to Dr. Latchman, who served on the American Nurses Association Center for Ethics and Human Rights Advisory Board from 2010, patients with cancer as well as AIDS, amyotrophic lateral sclerosis, other advanced or terminal diseases, poorly managed pain, and other symptoms commonly make requests for hastened death. Although, since assisted suicide is not legal in more than 5 states in the U.S., the number of people who ask for this treatment is not significantly high. Oregon is one of those few states that accepts physician-assisted suicide. And Dr. Latchman cites that approximately 1 of 1,000 dying Oregonians obtain and use a lethal dose of medication. 17% personally considered it as an option during the previous year. Since the number of patients who ask for this procedure is not high, this does not mean that it hasn't been requested in other places. Many people have asked for it elsewhere, and doctors or nurses have put their licenses at risk to fulfill the requests of their suffering patients. So now I have talked about the need for these patients to go through with this procedure. I will go on to talk about their financial factors that make the patients ask for this procedure. So financial factors can really take a toll on actually getting treatment for a person with critical disease. Sure, patients want the agonizing pain to end, but they also consider physician-assisted suicide because of the financial state that they might be in. Medications and treatments for critical diseases in the U.S. are very expensive, and for many, they're very difficult to pay for. Patients might consider physician-assisted suicide because the treatment options for the certain disease might be overly priced. And according to Constantin J. Deeds from 2004, a member of the Department of Oncology in the University Hospital of Zurich, Switzerland, the increase in the healthcare costs in all developed societies has led to an emphasis on the more economical treatments. Meaning that people are going for treatments that are least likely to help them because of the high medical cost. In the long run, people do not get the right medical treatment or the medical treatment that they really need, and they end up suffering longer than they should. That is why people should have a choice as to whether they want to continue living with the patient with the painful disease or end their pain. Now that I've talked about the financial factors, I will go on to conclude. So the physician-assisted suicide should really be considered and should be legal in all 50 states. First, I defined physician-assisted suicide and euthanasia. Then I discussed the patient's need for such a procedure, and finally the financial factors that the patient might have. Nobody should be forced to live with a terminal disease. So I hope that you really consider supporting physician-assisted suicide. Thank you.